Hello, welcome to Life Matters. My name is Brendan O'Connell. Well, our guest today is an author and a medical doctor who has seen enough in her years of being a medical doctor to form some opinions that feel that our society, in particular our medical community, has let down our young people, whether they're really young or teenagers or young adults. And I just want to give you a brief background of some of her schooling. She received her medical degree from New York University and did an internship in pediatrics at Beth Israel Hospital in New York City and completed a residency in psychiatry, followed by a fellowship in child and adolescent psychiatry in North Shore Hospital, Cornell University Medical College. Well, welcome, Dr. Miriam Grossman.
Thank you, Brendan. I'm so pleased to be here with you.
Dr. Grossman, I would like to talk about several of your books today, but first I'd like you to explain how your experience at UCLA in Los Angeles, how did that change your thinking about medicine, and what our teenagers and young adults are being taught in our society?
Well, I worked at UCLA for 12 years in their counseling center, and during that time I saw thousands of students. And what happened is that, as the years passed, I recognized a certain pattern and certain things that were going on with my patients, especially my female patients. And that is that many of them were filled with regret about the sexual decisions that they had made in the campus culture, the hookup campus culture, in which casual hookups are the norm and dating is dead, and in order to socialize and find a companion, a partner in life, people are often hooking up and having these random sexual experiences with near strangers. And the people who were coming in, of course, they had a variety of problems, but it was not unusual for me to discover that their sexual decisions contributed to their distress. And what I mean by that is, for example, kids that were coming in who had been diagnosed with a sexually transmitted infection. And you may not be aware that the levels of sexually transmitted infections are so high. Another young person is infected in this country every 3.5 seconds with a sexually transmitted infection. So it could have been someone who was recently diagnosed, or people who are fearful that they may be infected, or that perhaps they may even have HIV. It could have been, people who were coming in, again, predominantly young women, who had hooked up and had casual sexual encounters with someone, and they realize after a while that they've developed feelings for the person. They become attached to that person, and the young man, more often than not, doesn't feel the same way at all. There could have been, a pregnancy, an abortion, any number of things. So I looked into this further, and I looked at what we're telling kids about sexuality and about human attachment and so on, and I realized we're failing. My profession, the medical profession, and those that teach sexuality in schools are failing to adequately educate young people with the science that they need to know in this area. And so that's what sort of kicked off my activism, if you will. It's because of these students that were coming in, and they were so upset and distressed, and their life was impacted in a negative way. Their GPA would fall. They might be depressed or anxious, not sleeping well, and so on and so forth. So I realized that there's a lot of politics in my profession, and that there's a lot of ideology, radical ideology that's come from the left that has impacted my profession. And I wrote my first book called Unprotected. A campus psychiatrist explains how political correctness endangers every student. And I wrote that book about 10 years ago, and I wrote it anonymously, in fact, because I was so concerned about the impact it would have of my coming out and saying things that no one else was saying. So there's chapters there about HIV and about abortion, about how the medical profession and other educators fail to let people know the science behind transmission of HIV and STDs and the limitations of condoms, and how protection really is not a valid term, not an accurate term to use. I mean, if a condom only protects 50% of the time against such things as chlamydia and gonorrhea, should we really be calling it protection? It's like a coin toss, whether you're going to be protected against transmission of the infection or not. Things like that. Abortion, I believe, is whitewashed. I believe that people are not told about the vast numbers of both men and women who have lifelong regret and sadness after going through an abortion. So there are many, many items like that. So first I wrote Unprotected, and that really did change my life. I began being asked to speak. Obviously, I didn't stay anonymous. I began to realize how much support there was in this country, in my profession, and indeed, all over the world, really, of people that agreed with what I was arguing in that book. Mm-hmm. So then, after that, I wrote another book because I went into depth. I researched the history of sex education in this country, how it started, what it is now, what the problems are with it now. And I wrote a book called You're Teaching My Child What? And that is primarily an expose of the sex ed industry, which consists mostly of Planned Parenthood, an organization called Psychiatrist, and then some other groups that are involved with creating the curricula that are now institutionalized in so many places. But I travel around these days helping out communities, grassroots organizations of parents and grandparents who are concerned about what kids are being told, about the encouragement of sexual activity at a young age, encouraging young people to experiment and telling them that if they use condoms, they will be protected. All the ideas about gender and about the fluidity of male and female, all sorts of ideas that I believe are false and also destructive.
Can I ask you, the Planned Parenthood types, they teach what they call a risk reduction strategy, and versus risk avoidance.
Right.
And as far as the porosity of condoms, is that the reason why there's a high failure rate, or is it because the condoms are not put on correctly, they fall off? Why is it that condoms are not effective half the time?
Well, you see, it all depends on what we're speaking about. Are we speaking about avoiding pregnancy? Are we speaking about avoiding sexually transmitted infections? Because all these different situations have different rates of efficacy, condom efficacy. So, for example, if you're talking about preventing pregnancy, if you have two adults who are using condoms, every time, they're placing the condom on correctly, using it every single time that they have intercourse, there's a high success rate in preventing pregnancy. It's something like 85 or 90%, or it might even be a little bit higher. I don't have the percent on the tip of my tongue right now. But the thing is that when you start talking about adolescents who typical use is not going to mean that they always have a condom available, that they use it correctly, and so on and so forth. So you're going to have a much higher failure rate in a teenager. And when you're talking about STIs, it all depends on which one. Viruses, for example, like herpes and the human papillomavirus, which are both very, very common. They live on the skin, and they can live on the skin around the genitals that is not covered by a condom at all. So with human papillomavirus, for example, the efficacy of preventing transmission may even be close to zero. With herpes, it's higher than that, but it's still low. I mean, it's under 50%. I believe it's 30 to 40%. So, but with something like HIV, where the virus lives inside in the semen, you would have to actually have the semen escape. Then the condoms do better than when the virus lives on the skin and can be transmitted that way. So it's not a simple question. But in general, young people fail to use them. They report that during their most teenagers report that during their last sexual encounter they did not use a condom. They may sometimes use them, but it only takes one encounter. You well know this, but it only takes one encounter to get pregnant or to transmit a sexually transmitted infection, and some of these diseases can be quite devastating, if not deadly. So, we in medicine, when it comes to disease prevention, we're very strong, for example, about warning kids about smoking and alcohol and tanning salons and diet and many other areas. We're firm, and we speak. There's no ambivalence about it. We say it's not good for you. Don't do it. Don't go to tanning salons. Don't get involved with drugs and alcohol. But in this area, that's not what's going on. We actually give kids a green light, and we say, go ahead. This can be healthy for you. This can be a normal part of adolescence. Just make sure you use a condom. That's why I say that comprehensive sexuality education is not about sexual health. It's about sexual freedom. And when sexual freedom is the priority, sexual health is going to suffer. Now, you mentioned a moment ago about risk avoidance versus risk reduction. Mm-hmm. Yes, comprehensive sexuality educators say that theirs is a model of risk reduction, and the model of abstinence would be called risk avoidance. But in every other area of health, we use the model of risk avoidance. What I believe that if you look, now this is very important, you have to look at the material that's created for kids, the websites, the curricula, the videos on YouTube. You have to look at that and not at the material that the sex educators create for parents and policymakers, because they will claim one thing and then do another. For example, they'll claim that they agree that it's best if teenagers delay sexual behavior until adulthood, or at least until they've graduated from high school. They'll say, yes, of course, we acknowledge that that's the best thing. But then if you look at what they are telling young people, they say it's up to them and that they have sexual rights and they have the right to make their own decisions in this area. And Planned Parenthood even says that every young person, and this would include children, have the right to take whatever risks involved with sexual behavior that they feel comfortable with. So this is really quite astonishing that professionals who claim to be, authorities and responsible educators and professionals are telling young people that they should decide what they're comfortable with. They get to decide when they're ready for the big decision of becoming sexually active. Can you imagine if we use that approach in any other field of healthcare? I mean, we know that the teen brain is immature. We know that teens make poor decisions all the time, and then the next day they say to us, I don't know why I did that. And we say to our kids, what were you thinking when you made that decision? And the child says, well, I wasn't thinking. And it's funny because it's actually medically accurate that the teen brain, the area of the brain that's like the CEO, that thinks things out, that considers consequences, that makes rational, thought-out decisions, that part of the brain doesn't mature until the mid-20s. And so we are making a grave mistake when we put the decision into the hands of kids, what's the best time for them to become sexually active. The truth is that the medically accurate truth to tell young people is that it is best to delay sexual behavior until adulthood and ideally until they are with the person that they plan to spend their lives with. And if two people delay sexual behavior and then get together, they have zero chance of contracting any of these awful infections.
Can I ask you, do these people that are given these sex ed classes, I've heard, I don't know if it's true, but do they feel increased peer pressure to have sex just to get it over with?
Well, some do. You mean the students? You're talking about the students,
right,
not
students.
The teachers.
Correct.
Well, some do, sure. There is a lot of peer pressure. Although to a certain degree there's sort of a groundswell right now of opposition to all of this, and being proud that you're waiting and delaying sexual behavior, but it's nowhere near as large as it needs to be. And again, I place the blame on the professionals that are creating these programs for kids that tell them that it's up to them when they become sexually active, and in fact, they will often tell kids that if you can't decide what to do, then sit down and just talk it out with your partner. So, you might have a 14-year-old girl whose boyfriend is a few years older, and Planned Parenthood tells her to sit down with her older boyfriend and decide whether she should have sex with him.
Well,
yeah.
And what do you make of some of these professional organizations that are allowing this to occur? Is there a backlash within these professional medical organizations, psychiatry? I know the American Psychological Association is under a lot of criticism.
Well, there is now growing opposition within at least two professional groups, and that is pediatricians. Quite a few have broken off from the mainstream American Pediatric Association and formed the American College of Pediatricians, which has a altogether different approach toward this area that we're discussing as well as other areas. And then the other group would be the pro-life OBGYN group.
Oh, yes, APLOG.
Yes.
American Association of Pro-Life Obstetricians and Gynecologists.
Correct. And they have also broken off from the OBG, the
ACOG, the American College.
Thank you.
American College of Obstetricians and Gynecologists.
Okay, I never get these exactly right. In my own profession, I know them, but not in the others. So, in fact, we're going to be having the first joint meeting of those two organizations, the American College of Pediatricians and the APOG, the OBGYNs. We're going to be meeting next month in Houston, and it's just going to be fabulous. Maybe you can cover that. So there is a groundswell of opposition, but we still are in the minority, and of course we're called, religious fanatics and all of the names that people are always called without dealing with the substance of the issue. But I feel, and I wrote about this at length in my books, especially in Unprotected, that the mainstream medical groups have been hijacked and by activists on the left who bring in an ideology, and it's kind of foisted upon the organization, and successfully so. So that's happened in psychiatry and in other organizations as well, and it's very disturbing. There are more doctors than you might imagine who, for example, don't agree with the whole ideology about transgenderism and that children should be left to their own devices and decide whether they feel male or female, and that whole world of transgenderism, which now is we're all hearing so much about.
I see. And you have another book, I noticed, called The Black and White Puppy. What's that book? Is that your latest?
Yes, that's my latest. I wrote this little children's book because I was so disturbed as a child psychiatrist. I was so disturbed with what kids are being taught about intimacy, sexuality, gender, family, and this book is just it's a cute little bedtime story, but within it, children are introduced to some very interesting biological facts about their mothers and fathers and a family. And I say, for example, there that the bond between a mother and an infant is unique. There's nothing like it. A child is born already knowing and loving his mother, and I want children to know this because they're being led to believe that all sorts of families are equivalent and there's no ideal. Of course, I want you to understand, Brendan, that I know that there are many sorts of families that are out there, and I don't mean to make anyone feel badly about their families. However, there is an ideal. The ideal for the parents and children is for the biological parents and the biological children to all be living, together in one household and to be raised under those conditions. That is an ideal. Does everyone get to live that ideal? Of course not. But that doesn't mean that we stop telling kids that this ideal exists and it's something to strive toward. And indeed, hard science affirms that this is an ideal, and that kids, the idea of intentionally creating a situation, as we do with surrogacy, intentionally creating a child that is going to be removed from his biological, or from the mother that
gestated him?
The gestational mother. It's getting so complicated now. But yeah, that is going to be intentionally removed. That is not a natural thing to do. That represents a loss to the child and a loss to most moms. It's just not a natural situation, and it's being presented to kids as another option. That these are all options. That families are created in different ways. There's the old-fashioned way, and then there's all these new ways, and that they're all fine and they're all the same.
Right. I know that the homosexual marriage case in front of the Supreme Court this last year, which the Supreme Court favored homosexual marriage, the homosexuals put forth the argument that, oh, there's no difference between a biological parents and say a homosexual couples and that sort of thing. So that it was called the no difference strategy. And I had on as a guest Reverend Paul Sullins, a sociologist of Catholic University, who has looked at extensive research in this regard and has said that, yes, there is difference. There's quite a bit of difference, and we did a show on that more recently.
Oh, I'm so glad you did. The thing is, though, you know, it tends to be, like you just said, people from the faith community that are speaking out. And what I don't get, and I'm going to be speaking about this at the conference next month, is why, you know, this is medical territory. This is psychiatric territory, to talk about the biological bonds that exist between biological parents and children, but especially between the moms, because during pregnancy there are conditions, hormonal conditions and others that cause a bond to exist between the mom and her baby. Let me just tell you this story, which I got from a book that I want you to know about. You've probably heard of Robert Oscar Lopez.
I think I have. We're running short on time, so...
Okay, well, let me just... I'll just want to tell you something. A woman who had been adopted at birth had a memory. Her first memory was of beautiful music. And she couldn't figure it out because her adoptive family, as wonderful as they were, had nothing to do with any kind of music. She found her biological mother, who had given birth to her. She found her when she was 30. Lo and behold, the woman was a singer. And what she was remembering was her mom singing while she was carrying her in pregnancy. And this, to me, just highlights the amazing connection that exists between mother and child that begins way before birth.
Mm-hmm. Well, Dr. Grossman, there's so much we could talk about today, and who knows, I may make it down to that conference in Houston. But thank you so much for taking time out of your very busy schedule to be on our show today.
You're welcome, Brendan. Thank you so much for having me.
And we hope you found today's show to be unique, informative, content-rich, truthful, and thought-provoking. Thanks for watching. I'm Brendan O'Connell, your friend for life.